I'm delighted to be able to join you today on World Cancer Day for the Irish launch of the European Cancer Organisation's Time to Act campaign. I'd like to acknowledge the work of the European Cancer Organisation right throughout the COVID-19 pandemic to keep cancer centre stage and to encourage patients not to delay actions on any cancer concerns that they may have. From the outset of the pandemic, Ireland's National Action Plan on COVID-19 identified the continued provision of cancer care as a priority. Cancer services have continued to operate right through the pandemic while adapting to the need for appropriate physical distancing and infection prevention and control measures. The Time to Act campaign highlights the importance of action by all of us if we encounter any warning signs that might indicate a possible cancer. The initiative also stresses the importance of not delaying any screening or any treatment procedures. As happens across Europe, cancer services in Ireland were significantly impacted by the first wave of COVID-19 from around March to June of 2020. There was a substantial drop in the number of patients presenting to their GPs with cancer symptoms at that time. However, encouraged by really strong communications on the continuity of services, referral figures from GPs to cancer treatment services began to recover, and this recovery gained momentum over the following months. Data on cancer diagnosis and treatment shows that there has been increased resilience in the health service during subsequent waves. Also, over time, the confidence of Irish people that they would be diagnosed and treated in a safe and effective manner has grown. This is underlined by the fact that the number of patients referred by their GP to rapid access breast, lung and prostate clinics in 2021 was 130% of the corresponding figure for 2019. During this time, I've provided significant extra funding for cancer services in Ireland. An extra €57 million was allocated for cancer services in 2021 and a further 40 million secured for this year. This is being used to address the disruption caused by COVID-19 and also to develop quality cancer prevention, diagnosis, treatment and aftercare services in line with the National Cancer Strategy. The continuation of cancer services is testament to the great commitment shown by our dedicated and hard-working healthcare staff right throughout this pandemic. They've continued, often in the most challenging of environments, to give expert, compassionate care to our loved ones with cancer. I'd like to take this opportunity to acknowledge the focus being put on cancer at EU level through Europe's Beating Cancer Plan. Ireland very much supports this initiative, which aligns well with our National Cancer Strategy, and my officials will continue to engage to advance the various flagships of this plan. I wish to thank you, the European Cancer Organisation, for highlighting the important issue of cancer through your Time to Act campaign. It continues to be hugely important that we spread the message that cancer diagnostic and treatment services are open and that people should follow up any cancer concerns with their GP, who will arrange appropriate follow-up care. As we emerge from COVID and resume more normal life, we can build on the resilience we've gained and share our knowledge on adapting to the needs of cancer patients. Working together, we can really have an impact on preventing cancer and on improving the lives of those living with and beyond their cancer diagnosis. To all of you who work in cancer services right across the spectrum of healthcare, I want to add my sincere thanks for everything you've done over the last 2 years. It's been a brutal time for everyone working in healthcare. It's been a brutal time for patients. It's been a brutal time for the people you treat, for their families. I know a lot of the work that has been done at sacrifice to you. These have not been easy times, but day after day after day, you've come to work and you have been professional and compassionate and expert in what you've done. And I just want to say thank you for all of that.